Nearly a month after the novel coronavirus outbreak began in China, the whole nation is devoted in fighting against the virus, and the dedicated efforts are finally paying off. The number of confirmed cases has gradually declined in 16 consecutive days outside of central China Hubei province, the epicenter of the epidemic. The control and prevention measures taken by the Chinese government were praised and supported by many, including the World Health Organization.
Almost all member states were praising China for what it did,
while the United States is busy bashing China. First, let's take a look at the real-time data. So far, out of 76,000 confirmed cases, over 20,000 patients have recovered, among which 15,000 are from Hubei, meaning the cure rate of the pneumonia in Hubei province has reached 24%, and the cure rate outside of Hubei has surged to 59%. Well, the numbers speak for themselves. The turning point might be on the horizon. Undoubtedly, the coronavirus has been the most sensational headline for most international media outlets, especially those headquartered in the United States. Although the American government is facing a deadly flu season at home, the media coverage on that matter seems much lighter than what has been delivered on the novel coronavirus. The CDC estimates that 14,000 people have died and 250,000 people have been hospitalized so far during the 2019 to 2020 flu season. Some might argue that the flu is a familiar story that reoccurs every year and the cases are geographically widespread. There's no epicenter or hotspot, whereas the coronavirus is brand new with a high concentration of infected people in a short period of time. Yes, I agree. I don't think it is appropriate to compare the coronavirus with influenza, yet the way both governments are handling the challenge is worth noting. China and the US, the two leading world powers, are both facing a tough task at the moment. It's not about the trade, it's not about the race to 5G supremacy, it's about something humanitarian to protect its citizens, even the world, from a deadly disease. The United States was the first country to order the evacuation of its staff in Wuhan and put restrictions on the entry of Chinese nationals into the country. I guess the American government did what it had to, so did the Chinese government. 3 weeks after the outbreak, the Chinese government ordered a lockdown in Wuhan, a city of 11 million, and constructed 2 special hospitals in a record speed of 10 days. These hospitals are currently home to more than 2,000 patients in critical condition. Over 30,000 doctors and nurses from across the country are being dispatched to treat the patients in Hubei. Residential compounds were made to set up checkpoints at the entrance and to record the body temperature just to minimize the chance of further transmission. Meanwhile, the government called for their citizens to cancel outbound tourism plans to prevent the disease from reaching other countries. Also, the virus gene sequence was shared with the World Health Organization. Now let's circle back to 2009. At this time, the US was battling the H1N1 outbreak. It took 6 months for the US to declare a national health emergency. The World Health Organization declared H1N1 a public health emergency of international concern, but from the onset of the outbreak in April 2009 to the end in April 2010, did the governments around the world tell their citizens to leave the country? Did they close their doors to American citizens? Nope, not at all. Today, China and the United States are facing a disease on a large scale. Americans have made their own decisions, so have Chinese. No one deserves criticism at this moment, especially as China fights a new battle with an unfamiliar foe. As we fight for a community with a shared future on the global stage, the virus will not pick sides based on different social systems or ideologies. Neither should we.